What are your thoughts on the immune checkpoint inhibitors? And that's we're talking about primary, right? We're not talking about like late, treatment for recurrence. We're talking about like upfront treatment.
We're talking about upfront treatment. Absolutely. So previously untreated treatment. The thoughts on immune checkpoint inhibitors. I mean, I would think based on some of the work that I've been fortunate to be a part of, you would think that in an immune-rich environment with an infection and you have some drug that can potentially modulate the immune system to turn it on and activate and find cancer, that this would be perfect for it. You would think that let's give some immune checkpoint inhibitors before, see what happens, and hopefully this whole thing just melts away. But the reality is that the major pathologic response when immune checkpoint inhibitors are given before surgery, and there have been a number of trials that have done this, I think 7 or 8, the response rate, the major response rate, meaning only 10% of viable tumors left or less, the response rate is anywhere between like 3 and 30%. So it ranges. We're not sure why. And the question is how can we really understand that? What can we do to figure out why and what theoretically might be a phenomenal use of checkpoint inhibitors? Why is this functionally not happening when in vitro we see it potentially happening? And so we are actually opening up a trial soon that looks at giving checkpoint inhibitors before surgery, then taking the blood and the lymphocytes, and then looking at that in a functional way, again, through the vaccine center with Rafi and Andreas, to better understand and see what is the discrepancy. Why is there a difference? And hopefully we'll get some meaningful data. I mean, it's just a window of opportunity trial with 20 patients, but we are hopeful with their expertise. I mean, they're just so smart. They're so good that we can really understand and maybe get a better idea of why this isn't translating.
So more to come.
More to come.
More to come.